It's Friday, December 23rd, Christmas Eve, just around the corner, but we are not actually here today. We recorded this introduction to one of our previous Morning Medical Update episodes for you to watch while we are all home getting ready for Santa. Okay, you two have done more costume changes than I have. Did you win an ugly Christmas sweater with this? Please say you did.
I did. Unit 15, they had this ugly Christmas sweater contest a few years ago to raise money for some needy patients on the floor, and this may have won, and I may have made the winning bid on this ugly Christmas sweater.
Did you go to like Michael's and do something with those?
No, somebody else built it. I just wear it.
Wonderful.
I just sport it because I'm pretty cool
They
looking
did
like
a
this.
great
You know what
job.
I'm saying? Yeah.
And
I don't know.
and
Elvis
you-
is pretty ugly.
Now this is taking me back to my Vegas days, and I like that.
But let's talk about your feet.
Let's talk about my feet.
Whoa, yeah, okay.
See, now you can always know when I'm around the corner.
Yeah. You know, the good news is the Chiefs game is right around the corner, so what we safe about that?
Yeah.
K-C-Mo, ho, ho.
Good one.
Pretty good.
Always
That was
getting-
pretty good.
That is a good one.
Ho,
Okay,
ho.
that is a good one.
Yeah, right, fine.
Okay, so, let's talk about this. I think most people think that strokes only happen to older people. Not that I'm looking at you.
Yeah, thanks for looking at me.
But we learned in this episode last May that it can happen to people at any age.
Well, this is the one in which our guests were two 16-year-old girls who each suffered a stroke and the profound effect it had on their young lives.
Their mothers joined us, as well as one of our leading stroke experts, to talk about the risk factors of strokes and why immediate care is the key to a good outcome.
It is a powerful and emotional episode that if you missed when it first aired, we think it is worth it showing again, especially around Christmas, the time of hope.
Absolutely. And in the meantime, we want to remind you that we'll be back with you with all new episodes of the Morning Medical Update on Wednesday, January 4th. But until then,
Happy
holidays.
Go Chiefs.
According to the American Heart Association, strokes have increased in young adults by 40% over the past several decades. Two teens who both suffered strokes hope their stories will be a wake-up call. You'll meet them now on the Morning Medical Update. Good morning. It is finally Friday. It's May 27th. Thank you so much for being with us here on Facebook, YouTube, and on Twitter. Coming up today, how much do you know about stroke? We'll put your knowledge to the test to help you understand the signs and the problems strokes can cause. In about 15, Dr. Hawkinson will join us with the COVID count and the latest COVID headlines. But first, stroke does not discriminate. Two teens at their peak rushed to the hospital after suffering serious strokes. What doctors discovered and how they are doing today. Get your questions sent in to us on YouTube, Facebook, Twitter, and the Medical News Network. You can find links to those all right there on your screen. Well, every year, nearly 800,000 people have a stroke. 1 in 4 have had a previous stroke. A stroke happens when the blood supply is blocked to part of the brain or when a blood vessel in the brain bursts. The University of Kansas Health System is the 4th hospital in the nation to receive Advanced Comprehensive Stroke Center designation. This year alone, we have treated at least 255 stroke patients, and that number is likely higher since this information was gathered back in April. And you might be surprised to learn teens can suffer stroke, like two of them joining us this morning, Molly Ogden and her mom, Allison, and Madeline Mudd and her mom, Marcy. Both teens suffered strokes at the age of 16. We are also joined by neurologist and director of the Advanced Comprehensive Stroke Center, Dr. Colleen Lechtenberg, and of course, Dr. Steve Stites with us today to talk about all this. Good morning to both of you.
Good morning.
Good morning. All right, ladies. Good morning. Thank you so much for joining us and sharing your story. Molly and Madison, these young ladies, we want to hear your story. So let's start with you. Give us, the viewers, a background of what happened when you suffered the stroke. Molly?
I can't remember my stroke.
Mom, can you talk us through what happened and
Sure.
when you...
Molly had an injury in a powder puff football game and dissected her carotid artery. She had an underlying blood condition that we didn't know about prior to her stroke. So it was kind of a perfect storm of situation that all contributed to a clot developing in that artery and then breaking off and going to the brain.
Madeline and Marcy, can you talk about your story as well? What happened?
So I was 16 and I was a competitive figure skater. I still am. But so I woke up one morning, I went to the ice rink, and I got a really bad headache. So I rushed off the ice. My friends and my coach later came in and found me on the floor of the locker room. I had suffered a massive brain aneurysm rupture.
Wow. Mom, what was that news like for you?
Well, actually, she had just texted me and said that, because it was early in the morning, and she'd said the ice was busy and she had gone on a Starbucks run and was going to come back and skate the last session. And then a couple minutes later, the rink called me. One of the managers called and said, hey, she's collapsed. We've called 911. And I said, hold on. I'm flying down there. And I flew down there, and the EMT completely missed it. He assumed she was a hysterical teenager. He assumed she was hungover. She was on drugs. He 100% missed that she had a ruptured aneurysm, because it's not common in 16-year-olds. So long journey before we even got to KU. We were at two other well-known hospitals who could not treat it, and the second hospital sent her to KU.
Wow. And frustrating, Dr. Lechtenberg. I want to talk about that. And she mentioned it, how rare it is. How rare is it? Explain that to us.
Well, typically people think of stroke as something that happens in just older adults, but it does happen in younger adults. It's estimated about 70,000 adults or young people a year have a stroke. About 10 to 20% of strokes actually occur in young people less than 45.
Well, it must be rare, because the folks that were treating her thought it was all of these other things. That must be so frustrating for a parent and certainly for a patient, and then lost minutes at
Exactly.
that. Talk about that a little bit.
Well, time is extremely important when we're treating stroke, regardless of what type of stroke. So it's very important to recognize stroke symptoms so you can get treatment as quickly as possible.
So why do people suffer strokes? Who is susceptible?
Well, the older you get, the more vulnerable you are to getting a stroke. But at any age, people can have a stroke. Kind of the more typical risk factors for stroke in older people are the usual cardiovascular risk factors like hypertension, high cholesterol, smoking, obesity. But there are different causes in younger adults.
Dr. Seitz, feel free to jump in with any questions, but why would a young person have a stroke? Are these freak accidents? She said she had an undiagnosed blood condition, but how would you even know to look for that?
Right. The causes of stroke in young adults, like I said, is quite different than adults, but there's a variety of causes. Like Molly said, her mother said, dissection is, one of the causes of stroke in the young.
And talk a little bit about what dissection really
So
is.
dissection is when the blood vessel has an injury. It can be either traumatic dissection or it can be spontaneous. And because of that tear in the blood vessel, a subsequent stroke can happen.
I think the key is the blood vessels, the walls get torn apart a little.
Yes.
The blood dissects in between those walls,
Right.
and then it can't get to where it's supposed to go. It's stuck in there.
Yeah, either by that or then that tear accumulates blood products that then subsequently go to the brain.
I want to find out how both of these young ladies are doing today, and I'll let Mom tell us a little bit about how Molly's doing.
She's doing well. She just moved out of our home, so she's living independently with her brother. So that's an exciting thing. The part of her brain that was affected by her stroke primarily affects her communication. So she still has a really tough time talking, reading, and writing. So that makes it difficult to have a job that she might choose to have. But overall, really great attitude. She's driving again, so she's really gained a lot of independence.
Dr. Lechtenberg, will she gain that communication back? Your time?
No, usually the recovery from stroke is, initially in the first, weeks to months to years. I think Molly is about 10 years out from her stroke. So likely she won't regain too much more of, the ability to, speak and communicate.
So that's pretty typical.
Yes.
No matter what your age is.
Exactly.
Madeline, how are you doing today? Are you back you're on the ice still?
I am. I came back to skating as an adult, and I'm not practicing on my own as much as I used to. But I am coaching ice skating as well. I have been doing that for the last, 5 years? Last couple of years.
Mm-hmm.
Yeah. And I'm on an adult synchronized skating team. We actually just competed at nationals a few months ago.
Fantastic. Congratulations. Dr.
Thank
Lechtenberg,
you.
why does it affect some people some way? Is it the severity of the stroke, or does it just hit people in the parts of their brain differently?
Exactly. It depends on kind of the location of the stroke. Some people can have small vessel strokes and they don't have any symptoms. Other people can have a small vessel stroke in the certain location of the brain, and they may not be able to communicate. They may be, weak on one side or the other. So location is important in the brain with what the symptoms end up being.
You might talk a little bit about the urgency of this as well, because time is of the essence, and we think about time-related diagnoses and time-critical diagnosis like infection and heart attacks, but strokes are a big one. Can you talk to us about how important those first few minutes are after a stroke?
Right. Well, so it depends on what kind of stroke, but for ischemic stroke,
And that's one without blood flow.
So ischemic stroke is the one where the vessel's blocked and the surrounding area of the tissue is, starved for oxygen and nutrients. And then hemorrhagic stroke is a bit different, bleeding into the brain or the area around the brain. But time is of essence in any kind of stroke. But for ischemic stroke, you only have a certain amount of time that you can deliver treatment. 2 million brain cells are dying per minute, and so the faster that you can get treatment, the better a patient will do.
Dr. Lechtenberg, what are the interventions that you can do? Talk to us a little bit about some of those really, because this comes so far. When I was young, it was just a few years ago, and patients came in like this. You just watched them have a stroke,
Right.
and there's nothing you can do. Such a different story today.
Right. Treatment of stroke, whether it's from aneurysm or ischemic stroke or hemorrhagic stroke, has really come a long way in the past decade. For ischemic stroke, there's two different types of treatment. One is a clot buster medication that can be delivered to kind of break the clot up and restore blood flow. And then the other one is called a thrombectomy, and that's where the interventionist uses specialized tools to take catheters up to the location of the blocked vessel and remove the clot and restore blood flow. So those are the two kind of main treatments for ischemic
And
stroke.
those are really done in specialized areas where they have enough volume to be good at this, and have actually, in the best situation, if you want to have the clot busting medication, you kind of want to be that directed, not just give it to you through a peripheral vein.
Well, you definitely need to be an advanced comprehensive stroke center to do thrombectomy. It takes very specialized physicians with skill, and you're right, a higher volume of patients so that they're good at what they do. The clot busting medicine can be given at any hospital, which is good because there's only 2 comprehensive stroke centers in Kansas, and so the fastest treatment for ischemic stroke is the clot buster medication.
So what impact did COVID have on stroke patients, and then did we see the numbers change? I'm sure you've gotten a lot of questions about that.
Oh goodness, yes. I think COVID impacted nearly every area of healthcare, and it really impacted stroke patients and stroke care. But our goal here at the University of Kansas was to continue to deliver the same high-level care with no delays to our patient population, whether they had COVID or they didn't have COVID, but if they were having a stroke, to deliver the same care. But it impacted, I would say, every area of stroke care.
I have a community question that came in that is a good one. Erica wants to know if strokes are hereditary.
They can be hereditary. So, families live together, they share behaviors, environment. That can contribute certainly to risk of certain diseases, but there are certain conditions that can be hereditary that can cause a stroke. Blood disorders where blood clots more easily or people bleed. Aneurysms can also be hereditary as well. So there can be a hereditary component to strokes.
So something you're born with, or what factor does just your lifestyle or stressors and things like that, does that, we think of that, maybe that's just the layman thought, that's what I would think, is if there's just your lifestyle and what's going on and happening in your world, can that affect you?
Yes, that definitely plays a very large role in stroke. Lifestyle, activity, exercise, diet, and then those cardiovascular risk factors, which I mentioned before, like hypertension, high cholesterol, smoking, all of those can cause stroke.
All right, we are going to turn to Dr. Hawkinson and get a check on our COVID count and some COVID headlines. Good morning to you.
Hi.
Hi.
Today, again, we've been in the single digits for active infections. We are still holding there right now. 9 active infections, 2 in the ICU, none on the ventilator. Still 10 in that recovery period. Overall, it's continuing to look good. And Steve, we know cases are rising. Hospitalizations are rising, but if you look at any of those popular news sites like Washington Post, New York Times, you'll see that the how steep that surge is, or the increase is not as great as it was back in Delta and Omicron. So it's just trending up slowly, which is a good thing. Again, the more people we can keep out of the hospital, the better.
We are seeing that rise, though, and there's so many more patients that probably are infected than we know because of the at-home testing, the lack of the testing that was done, the testing stations, et cetera, before. We are seeing a slight bump in deaths for the first time, and that's a little concerning because we don't really know the total case volume. To see that rise in deaths makes us a little nervous, I think. And again, what can you do about it if you live in an area where you think, and you watch, the map is clearly turning. A lot more counties in the U.S. are now in the red zone, which means advice to go back into wearing masks indoors, and not a lot of mask mandates out there this time around, but I think a lot of strong advice that if you live in a county where you're back in the red zone because of the high level of community transmission and the high level of hospitalization, then it's probably want to think about putting a mask back on. And again, because we're starting to see a rise in deaths, makes me a little more nervous.
So is this the beginning of that June surge that you saw coming a couple months ago?
Right. Well, I think we're in the surge. I just think that because, and Hawk and I have had this conversation before, but Hawk, I think the combination of 60, 70, 80, and especially 90% of those over the age of 65 having been vaccinated, and 70% of Americans or thereabouts having had COVID has given us enough immunity that hopefully we will not see the rise in ICUs and severe rises in deaths that we have seen with the last few surges, Hawk.
Yeah, exactly. We are hoping that with the individual immunity we've gained from vaccination, just as you said, and from those people that have been infected and vaccinated or infected and reinfected, again, you have that immune response now to protect you from coming to the hospital. But also, we also know that if you have symptoms, test early. If you're at higher risk of progression to severe disease, then we have Paxlovid, and that is another large factor that we have to take into account as well.
And go back to that heat map for just a second if you can. If you look at the Northeast U.S., now look at the upper Midwest with Michigan, Minnesota, Wisconsin, and the Dakotas, and look at the far West, you can see where the real outbreaks are occurring. A little less so in the southeastern Midwestern region, but I think it has been marching inexorably in this direction. And I think this, we've had the waves that started more in the Midwest and the Southeast, the waves that started on the coast and came in, and this is on the coast and it's coming in. Hawk, your point about Paxlovid, dead on. The government is now starting, this sounds terrible, treat and street clinics where you go in, you test positive, you're given the script for Paxlovid, and you can take it home and get started on it. I think the Surgeon General was quoted yesterday saying we should not be seeing many deaths now from COVID because of the presence of Paxlovid, other good therapies in the hospital, and vaccination. And the last thing that I wanted to point out, we used to rely a lot on Decadron or dexamethasone for hospitalized patients, Hawkeye. Data out in the last couple of weeks suggests that maybe you're better off with the monoclonal antibodies and not because of the side effects of some of the steroids, because we have some other effective therapies like remdesivir and monoclonals in hospitals.
Yeah, this is just part of the fact that we are continuing to evolve our optimal vaccination, diagnosis, and treatment guidance. And so I think as we continue to move through this, we will continue to look at that and be able to optimize it. Again, the goal is to prevent you from coming to the hospital, but when you come to the hospital, prevent progression as much as possible, and of course death. So.
Dr. Hawkinson, word that reinfection is 8 times higher with Omicron than Delta. Tell us about that.
Yeah, I think that is part of number one. We understand Omicron probably has some fitness advantage over the other variants, but also understanding that there is a fairly good immune evasion, especially that antibody response evasion with Omicron compared to the other variants as well. And I think that's this is continuing to support all of that data that we have seen, that people were infected in the past or recent past, but then also now have got recently reinfected with Omicron as well.
Also, brain fog and other COVID symptoms, long COVID symptoms, can last more than a year, which didn't surprise me because that's pretty much in line with many of the long haulers that we've had on our show that are well into 2 years of this if they were infected at the beginning of the pandemic. But correct.
Again, it continues to support the fact that we have been talking about that long COVID, much like other chronic conditions that we are seeing in the healthcare realm, long COVID moving forward is going to continue to be a large factor in that. It will continue to take resources, a lot of time and effort. There are a lot of people who are going to be affected by this and continue to be affected by this, and it is going to be one more major comorbidity or one more major problem that people will be dealing with individually, and that they will be seeking medical care for as we move forward. I think this is one more, again, support for the fact of what we know. But just moving forward, this is going to be long COVID, brain fog, all that is going to be a significant issue within the healthcare system, both for individual quality of life, but also just trying to deliver that care to those patients.
Yeah, and I think, Dr. Hines, I think one of the struggles is too that we had really hoped that vaccination was going to protect more against long COVID.
Yeah.
And what we're seeing is some emerging evidence in the VA study that came out 2 days ago, that vaccination may lower long COVID by 10 or 15%, but not by 80 or 90%. Now, there's some conflicting data worldwide, but the VA study is a little concerning to me.
Yeah, and I was able to go through that study earlier today because it was concerning. It isn't necessarily consistent with some of the other data. Some other data suggests that you have a reduction in long COVID by 50%. I think this is still in line, and I think overall vaccination continues to be positive. We know and understand that in this study that was done, it was a retrospective study. They really looked at only 2 doses. As I said before, about 5 minutes ago, we are looking at optimizing vaccine scheduling, vaccine dosing. So now, obviously, there is at least 1 booster recommended for the majority of people. So I think moving forward, that plays a role into it as well. Obviously, the VA population will have something to do with that also. It's a good study, but it is retrospective, and there are those caveats there. But overall, I think we can continue to see a reduction in the chance of long COVID, any long COVID symptoms, with vaccination, especially if you are up to date. So.
Yeah, I think a 10 or 15% reduction is still a significant reduction. But Dr. Lechtenberger, the other thing we're seeing, and you and I were talking a little bit about this before the program, the number of strokes in COVID patients kept you all pretty busy.
It certainly did. Yeah, we had, we've been kind of gathering the information. We had quite a few, over 100 patients who had COVID at the same time as stroke. And so we're still kind of analyzing that information to determine, what role COVID played in the stroke. But it was apparent in quite a few of the cases that COVID had something to do with the stroke.
Yeah, and we know that death is 8 to 10 times higher in those who are not vaccinated than those who are vaccinated. Now we're starting to get some information coming in comparing what happens if you've had all your booster shots, or you've had a couple of shots and you've had COVID, or if you've just had COVID. And the data is pretty clear. If you had all your booster shots, you got a lot of safety. Yeah. If you've had a COVID and your booster shots, you got quite a bit of safety too. But if you just had COVID, not as good as safety, Hawkeye, because that risk of reinfection we know is high as with Omicron, and even natural immunity wanes after about 3 to 6 months of time.
Yeah. And again, looking at that New England Journal study that was just reported, again, that is against infection. We continue to understand that, vaccination and previous infection, you still have the chance at reinfection later or infection even after vaccination. Ultimately, we've seen that time has shrunk from the early stages of the pandemic now to the Omicron period. But overall, just like you said, this is for infection, so we'll continue to monitor that. What we really want to look for is the evidence and the support for continued protection against severe disease and hospitalization.
Well, if you're just joining us this morning, we're talking about strokes, the risks, signs, symptoms. We are meeting 2 young women, Molly Ogden and her mom Allison, and Madeline Mudd and her mom Marcy. Both suffered strokes at the age of 16. We're also joined by neurologist Dr. Colleen Lechtenberg, who is the director of our Advanced Stroke Center here at the health system, and Dr. Steve Stites with us as well to talk all about this. And I want to get back out to our guest joining us today. I want to know a little bit about how you've handled this. And I'll start with you, Madeline and Marcy, just what it's been like for your family and kind of how you've persevered through this really scary health time.
Well, it certainly turned her life upside down, and as well as our whole entire family's life upside down. She was a very healthy 16-year-old, had the world in front of her, could have done whatever she wanted. And her deficits are very, very different than Molly's. Madeline's are all cognitive. She doesn't have any communication or physical deficits at all. Hers are completely cognitive. She has very little short-term memory. And as a parent, when you've got a 25-year-old out there driving and trying to live their life, not having that short-term memory is very scary. She uses a lot of alarms, whiteboard, calendar appointments. She is able to work right now. She's working part-time, and she has a job coach through the state of Missouri. And without that job coach's support, she would not be able to hold down that job. She just doesn't have the cognitive ability. So she lives at home, and we're just trying everything we can do to get her as independent as possible.
Molly and Allison, same question. What does life look like now? How are you managing through this?
Like Marcy said, it definitely hit Molly. She was 16. She was a distance runner, tip-top shape, honor roll student. But not only her life was derailed by the stroke, but our whole family. She had a 14-year-old brother at the time. He's now 23. So, our lives changed as a group. And Molly is, on the flip side, cognitively, she's perfect. She understands everything. She remembers everything. Her memory is better than mine. So, in many regards. So again, her communication difficulties it's a huge struggle. So she's still weak on her right side. Right hand's not working the way she wants it to, but she's adapted physically. She had that distance runner mentality, so nothing was going to keep her down. She's able to drive herself to the gym. She volunteers at our church, but the communication, it's so frustrating. It not only makes it difficult to work, but just interpersonal relationships are tough. I can really understand her, and we communicate fine, but sometimes she meets people, and it's different, and some people are kind of shy away because it is a challenge to communicate with her. So it's been frustrating for sure.
Yeah, quite a challenge and a long road. So, Dr. Leckenberg, I want to talk about this because Dr. Seitz mentioned it. It's about those moments, those really crucial moments when it comes to stroke. So, time is brain. What does that mean when we talk about that?
Sure, that means 2 million brain cells are dying a minute when somebody's having a stroke. And so the faster somebody can get treatment to try and reverse those stroke symptoms, the better off that they will do. So
we need to act fast and we need to be fast.
Exactly.
So let's talk about be fast. That's an easy way for people to hopefully remember if they or someone they love is in this moment. Tell us about that.
Well, that's an education tool for the public on signs and symptoms of stroke, the importance of recognizing these stroke symptoms, and then seeking medical attention right away.
Can you go through some of those so people understand them, just to
Sure.
be clear?
Sure, and these are all sudden onset. So
and would it be all of these or just some of them or a combination?
It can be some of them, and there's actually other additional stroke symptoms. These are just kind of some basic ones to put forward, but it doesn't have to be all of these symptoms. But balance, sudden onset of balance problems or gait difficulty. Eyes, sudden onset of vision trouble, loss of vision, double vision. Face, sudden onset of facial droop. Arm, sudden onset of arm weakness, speech difficulty, trouble understanding, trouble talking, and then time for the importance of calling 911 and getting medical attention right away.
So you're supposed to notice this about someone else, but you might be feeling them yourself. What would be one or two that would stand out for yourself, for you to be able to act fast?
Some people can recognize right away that they're having a stroke, and then other people, depending on the location in the brain where the stroke is, they may not recognize that something is wrong.
So what's your advice to people when it comes to, if you know your body, if you know something's wrong, to act fast.
Yes, to go to the hospital right away and be evaluated. You will miss your treatment option if you wait at home. Some people do recognize that something is off and not right, and they wait at home to see if they get better. They might take a nap or go to sleep for the night and wake up in the morning. You will miss your opportunity, for these stroke reversal treatments if you don't seek medical attention right away.
Madeline, again, remind us, what was the moment that you knew something wasn't right? What were some of the signs you felt? Do you remember?
I gotta be honest, I don't remember that day.
No, her coach was with her on the ice, and her coach said that she just looked over and she had collapsed in the middle of the ice. And then she was grabbing her head, and then I'm not sure if she had a seizure. The reports from the girls were that she did have a seizure, but I wasn't there to witness it. She had the classic thunderclap headache, from what we can kind of piece together, where worst headache of your life. And then when I got to her at the rink, she was still awake, but she was not coherent. She was just screaming, and headache agony.
Yeah, we've heard that before on the show. It's a headache you've never seen before or ever felt before.
Right. And
Alice,
like Molly, Madeline doesn't remember any of it. Anything she says is just she was what she's been told. All those memories are gone forever. Kind of happy.
Which thankfully, yeah.
Yeah. Allison, do you remember what those around her remember as far as signs?
So actually, our story is interesting in that I found Molly. So she had gotten up for school and gone about her normal morning routine, and I found her collapsed, unable to speak, weak on the right side. I knew the fast symptoms, but when I saw them in my 16-year-old, it didn't click at all. All I knew was that something was very wrong, so I called 911, and fortunately, our first responders suspected stroke. So I remember getting in the ambulance with her and hearing them say possible stroke victim. And I fortunately was able to call her pediatrician. This is at 7 o'clock on a Monday morning, and actually got him on the phone. And he said to me, get her to KU Med and treat her like an adult. And I had no idea what he meant by that at the time. But we were taken by ambulance to Lawrence Memorial, which was the closest hospital for us at the time. The team there took her situation seriously and did a scan, found a clot. And at that time, they wanted to transport us to Topeka, Kansas. And I said, no, we have to get to KU. And so we went by ambulance to KU. And fortunately, my pediatrician's words were ringing in my ears. They confirmed the clot. She did get the clot busting drug and also had a clot retrieval that morning. So no doubt that series of events saved her life.
We have some great community questions coming in, so I want to get to those. Catherine wants to know, Dr. Lechtenberg, she lost her father to hemorrhagic stroke 12 years ago. What treatments have been developed since then?
Hemorrhagic stroke treatment is definitely different than ischemic stroke treatment. So hemorrhagic is when there's bleeding into the substance of the brain. There are different procedures where the neurosurgeon can put a catheter into the blood clot and put the lytic therapy in there and kind of break the clot up. In some patients, the hematoma or the blood can be evacuated. It kind of depends on the location.
And she wants to know also, does the BFAST apply to those type of strokes?
Yes, it applies to all types of stroke, yes.
Okay. Question from Ruth Ellen. Are strokes difficult to recognize? She said her mother was initially being diagnosed with a stroke, but then had an MRI and found out she had brain cancer. Can a stroke lead to diagnosing of something else?
It certainly can. So a stroke is the sudden onset of focal neurological deficits, but other things in the brain can cause neurological deficits, like you mentioned, a tumor is one.
Well, speaking of treatment, Isaac has an interesting question today, so I have to ask this for him. Do you think anyone will ever come up with an anti-stroke pill that we can keep close by in our medicine cabinet to prevent this?
The best prevention, and this is great news, there is a good prevention, and that's taking care of like your risk factors for stroke. It's estimated that 80% of strokes can be prevented if people modify their risk factors.
Which are?
High blood pressure, high cholesterol, diabetes, smoking, obesity, inactivity, and there's some additional ones, but those are the main ones. So
you can take caffeine away from everybody and solve.
In moderation, caffeine's fine.
It is, but it's true. We think about this a lot. You hear us talk about it a lot, that really at the end of the day, it's taking good care of yourself. There's the prevention from all sorts of diseases. And there's so much similarity between the preventative steps for cardiac disease as well as for neurologic disease that's related to how good a blood supply we have.
So I have to tell Isaac there's no magic pill just yet.
Not yet.
All right.
And but there is magic because kidney disease often is a vascular disease, meaning it's a blood vessel disease. We know heart disease, coronary arteries, blood vessel disease, stroke, blood vessel disease. How do you take care of your blood vessels? You got to exercise. You got to eat right. You got to keep your blood pressure low. You got to do the right things for yourself, and then you're gonna have a lot better chance of living a long time.
Julie said her 29-year-old had a stroke last week. Only sign was that headache. They told her it was from her birth control pills.
And young women are at particular risk with oral contraceptive pills and just peripartum, around pregnancy, before pregnancy, during and after.
But also just to say, it is true that birth control pills are associated with a higher risk of stroke. It is also true that many times there's an undiagnosed what we call hypercoagulable state. That is a state that makes your blood a little stickier, a little more likely, and then little things like a birth control pill can trigger it. So talk about some of those underlying things that can lead to blood clotting.
Like you mentioned, the inherited hypercoagulable condition, or even if somebody's like dehydrated and they're on birth control, it's typically not just birth control alone, but it can be birth control plus additional risk factors.
So are these like the blood clots people talk about with birth control? Is that?
Well, yeah, but I think what we're saying is that they can occur in isolation. We don't have another known cause that and then you're on a birth control pill and you get a clot. Now that's not to say there isn't one, we just haven't figured it out yet. But there's these other things like, protein C, protein S, factor V Leiden, dehydration, and other things that can make your blood just a little stickier, and you can do that, and you combine that with the birth control pill, or you combine something that's a little milder blood clotting disorder, like a factor V Leiden plus dehydration plus birth control, and then you get in trouble, and you may not even know that you have some of those, Dr. Lindenberg.
And even migraine with aura can be a risk factor for stroke as well.
Okay, couple more. I know they're trying to wrap me up, but I got a couple more good questions, and then I'm going to let you folks get back to work. So, question is about watershed stroke. Pam wants to know if you would address that. She said, I had several strokes 3 years ago, was told that was what it was.
A watershed stroke is when, the artery going up to the brain is either narrow or occluded. And if your blood pressure gets low, then you can have stroke, not because you've had a clot go up to the brain, but because that area is not perfusing because of the narrowing in the artery.
Okay, 2 more quick questions. Jean wants to know, does low-dose aspirin increase or decrease the chance of stroke?
Yeah, what year is it?
Well, and it depends on what kind of stroke too, because for hemorrhagic stroke, that's the bleeding type of stroke. Oftentimes if somebody has cardiovascular risk factors and they reach a certain age, the physician will put them on aspirin for primary prevention. We use aspirin a lot for secondary prevention for stroke after somebody's already had a stroke, and we will put them on antiplatelet agents.
And I laughed when I said, what year is it?
I was going to ask you what you meant.
Well, because the evidence goes back and forth sometimes, and more recently, does aspirin decrease the overall risk of death or increase the overall risk of death? Now, that's a different question than asking somebody after they've had a stroke. But that answer bounces around a little bit, and I think in the last month or two, it's been shifted to, gosh, we got to be a little more careful with aspirin. So it bounces up and down.
Okay, last question. Are people getting strokes because they've been vaccinated?
No.
I knew that was your answer.
Hawk?
No, there's very good evidence that certainly sometimes people can have adverse events after vaccination, but those adverse events are greatly reduced compared to those people who actually have the infection.
Yeah, and let me clean up my answer a little bit. There was some concern about the J&J vaccine.
Yeah.
And in fact, the FDA has now de-emphasized the J&J vaccine.
Yep.
With messenger RNA, that does not appear to be a concern. And to Hawk's point, the bigger risk, and to what you just testified to earlier, Dr. Lechtenberg, there's a significant increase around strokes in people who get COVID. And again, 8 to 10 times higher risk of death than if you've been vaccinated. So the evidence is it's just overwhelming. We just need to let go of the idea that vaccinations are deadly. It's not true.
All right, let's get to some final thoughts today on this Friday. Madeline and Marcy, I'm going to start with you. What do you want folks to know?
Like the doctor said, take care of yourself. Try to be as healthy as you can. Understand that it could happen to you. You just don't know. It could happen to anyone.
Madeline, anything to add?
People don't expect teenagers to have a stroke. But it helps if you know the signs and symptoms.
Thank you so much for sharing your story today. We really appreciate it. Allison, what do you want the takeaway today to be?
Definitely know the signs and symptoms of stroke. Don't hesitate to act if you think you're seeing anything wrong. Go with your gut. Trust your health professionals. It's important to know the best hospitals in your area. We've since moved since Molly's stroke, although we still keep our trusted physicians at KU. But when we moved, we asked where do we need to go if we have an emergency. So it's just important to be an advocate for your family and ask for what you want. And like I said, go with your gut.
Go with your gut. We love that. Thank you so much for spending time with us today and sharing your stories. Dr. Lechtenberg, final thoughts today.
I'm just going to reiterate what they had commented on, just knowing the signs and symptoms of stroke, knowing that there's stroke treatments available, but it's time sensitive, and know your resources, what hospitals are capable of doing what stroke treatments.
Dr. Hawkinson, final thoughts?
I mean, I would just echo the comments of our guests. It's so important to understand all of those signs and symptoms and just understand that it's important to try to live every day and be present every day. We are coming up on this holiday weekend now. Be with your friends and your loved ones, be safe, and just understand that, tomorrow is not a given. So try to live every day to the fullest and be appreciative and with those ones that you love.
What you got for us?
Hey, here's the answer. So about, I think 6 or 8 years ago, you and I were sitting around a table and you were trying to get me to say, now these are what we need to do to make our stroke program better. I remember that conversation. And I think the key is to listen to Dr. Lechtenberg, because I listened then.
You did.
And we got it done, and you and a lot of people helped in that. But you guys, you've done a great job with the stroke team. And to our audience out there, listen to the stories that you've heard and believe that. Believe the science. Trust the science. Just like vaccinations, they're safe. It's effective. You want to be treated for a stroke. It's safe. It's effective. And time is of the essence. And as you head into this holiday weekend, as Hawk said, remember the rules of infection control. They still travel with you. They still keep you safe wherever you go. Stay safe. Listen well. Be fast.
Thank you so much, everyone, for being with us today. Don't forget, you can catch our shows anytime by logging onto Facebook, YouTube, and Twitter.
Subscribe to our morning medical update and open mics with Dr. Stites podcasts. Now, everywhere podcasts are available.